Hey, everybody. Thanks so much for joining us right here on The Right View. Tonight, we are joined by cardiologist, epidemiologist, and the chief scientific officer of the wellness company, Dr. Peter McCullough. Peter, thank you for joining us. I think a lot of people have kind of gotten to know you, heard your name out there. You've actually been practicing medicine since the 90s. So give us kind of the background here. Tell me your story and how you ended up in the spotlight and kind of becoming more of a household name.
I grew up down in Texas. I went to Baylor undergrad, then University of Texas Southwestern, trained up in Seattle at University of Washington, did rural health in northern Michigan for 3 years, and then University of Michigan School of Public Health Cardiology Fellowship at what's now the Oakland University William Beaumont School of Medicine. It's a long training cycle, about 17 years in total from high school graduation. But I was always broad-based internal medicine and non-invasive cardiology. And I rose the ranks in academia. I was chief of cardiology at a major university. I've been the chief academic scientific officer of a major health system. And I was already a public figure. I was the president of the Cardiorenal Society of America. I was editor of 2 major journals. I had already testified in the Congressional Oversight Panel on a product label expansion in 2007. I've lectured at the European Medicine Agencies and New York Academy of Sciences. I was a visiting professor of medicine, the endowed visiting professor at Harvard in 2019. So I was already known in academic medicine. It's just that when COVID came in, probably of the few academic physicians that were prominent in the country, I really turned all my efforts to try to help people through the pandemic. And I became widely known for publishing the first treatment protocol to help people get through the illness. And I've testified 3 times in the Senate, and things have gone from there.
And so what was it that you recommended treatment-wise back during COVID? Because I mean, this was a time that, was so unique that none of us had ever experienced something like this. People were rightly frightened. People really didn't know who to trust, what to trust. We were kind of all just living in the moment and trying to keep ourselves safe and our families safe. What was it that you kind of tried, and what was the treatment plan that you kind of came up with?
Well, I can tell you from the very beginning, we understood that it was a very complex infection. It wasn't a simple infection. And even for simple infections, I can tell you for a staph infection in the hospital, we always use 2 or more drugs. So I can tell you for a complex infection like SARS-CoV-2 that involved inflammation, a very unusual form of a pneumonia, and then blood clotting, I knew from the very beginning, 1 drug was not going to do it. There was no silver bullet here, not at all. So what I had put together, I worked with a team of doctors largely in Italy early on because they were ahead of us in Milan, is the first treatment protocol that said from the very beginning, we need to start up top by reducing all of the viral reinfection. People were in closed areas and they kept breathing in the virus over and over again, so they needed to get fresh air. We learned fairly quickly that the virus would actually be killed in the nose and mouth with virucidal nasal sprays and washes. That was probably the biggest advance. It wasn't our first version of the protocol, but it definitely was by the end of 2020. And so we found out that povidone iodine and colloidal silver, xylitol, a whole bunch of various agents were very effective in reducing the amplification of the virus in the nose and mouth. And we would, nasal washes and gargles became standard. Then there was a line of over-the-counter nutraceuticals and supplements that were helpful. They weren't curative, but they were helpful. Probably the biggest one was vitamin D. Every single study on vitamin D taken at higher doses had an effect. There was an over-the-counter antihistamine antacid called famotidine or Pepcid. Turns out at 4 times the daily dose, that was effective. Everybody needed aspirin because there was blood clotting involved. We learned very early on that was important. And then the antivirals, they're the ones who got the most attention. But we learned from other doctors they were not necessary nor sufficient. So there's some protocols around the world that use no antivirals. But the first one we had available was hydroxychloroquine. Then we had ivermectin, and then Paxlovid, molnupiravir. We had monoclonal antibodies that became available to us in November of 2020. We added antibiotics to prevent bacterial superinfection. That would be azithromycin and doxycycline. We knew there was inflammation and corticosteroids played a huge role. So we used common ones like prednisolone or methylprednisolone, and then inhaled budesonide. And then lastly, blood clotting was a factor. So in high-risk cases, we actually used full-strength anticoagulation. So that's called sequence multi-drug therapy. It's intensive. Later on became copyrighted as a McCullough protocol. But the principles became the most widely utilized principles worldwide. And people have credited probably saving tens of millions of lives, saving hundreds of millions of hospitalizations. And we did the best we could on comparative data. By December of 2020, in a paper by Gougliakos and colleagues, I'm the senior author, we had clear and convincing evidence that early treatment was working.
Wow. Well, it doesn't feel like that the response you got to what makes a lot of sense. I mean, to hear you kind of talk me through it, and I'm not a doctor, but it seems to make sense. You hit a couple of key words in there, Peter, that I think really upset a lot of people. Hydroxychloroquine, ivermectin. Once you start talking about those things, I mean, pretty much immediately, we're probably going to get this entire show censored. What the heck happened? How did we go from people trying to work, as a team to figure out this novel virus, something that really shut down the entire world? People like yourself who obviously were working overtime to figure out how to treat this in so many different ways. And it sounds like you had come up with quite a few really effective treatments of it. What happened?
Well, hydroxychloroquine was only one of 4 to 6 drugs that we use. And I used it widely. It's got some safety caveats, but doctors understand that. We use it for rheumatoid arthritis and for systemic lupus, malaria prevention. So it played a role. It turns out that there was over 300 studies in the end showing hydroxychloroquine's benefit was modest, about a 25% treatment benefit. But somehow it became a lightning rod, certainly with former President Trump, and other things happened around the world. American media didn't carry this, but billionaire Clive Palmer in Australia had purchased a hydroxychloroquine stockpile for the entire country of Australia.
Wow.
And he was going to just give it out and help people. Do you know the government authorities seized it and destroyed it?
Oh my gosh. Wow. I mean, that's terrible, but this is kind of terrifying stuff. It's interesting because I remember, recommended a treatment plan during COVID. It seemed, again, very common sense based, especially for young people, to monitor their symptoms and not to panic. That became a big issue, though, right? What was the problem with that?
Oh, that's a good point. Do you know in most of the studies published on early treatment, only 25% of adults really need treatment, because younger people who are thinner, healthy, they get through it fine. They don't need treatment. So even the biggest study showed it was only 25% of the high risk. And what we had observed is those were predictable. People in their 80s, 90s, nursing homes, congregate living, people with severe asthma, heart failure, cancer, they were vulnerable. They needed early treatment. Healthy people could just breeze through it. So it was always, a risk stratified approach. We didn't suggest everyone needed treatment, but it was important not to panic. And, there were reports early on in 2020, the majority of paramedic runs that picked people up and took them to the hospital, the paramedics noted they weren't that sick. They didn't have to go on life support, what have you. Then people got in the hospital. People actually got sicker in the hospital.
Right.
And United States, we lead the world in COVID deaths. We're less than 5% of the world's population. Virtually all the deaths occurred in the hospital.
Mm-hmm. Well, you know what? I remember back, I had very young kids whenever the COVID outbreak happened. My daughter was 6 months old. My son was 2.5. And I was very conscious at the time that I knew, after we had kind of figured out that this was, as you kind of just pointed out, a virus that really was dangerous for the elderly population and people with comorbidities. I didn't have any issue with that, nor did my husband, and obviously neither did my 2 children. And so I wanted my kids to be able to go out and kind of be in the world as they otherwise would have, because as a mom, I had this moment where I thought, gosh, my kids are not in a setting where they ordinarily would be, in like a preschool setting or something. They're not able to be around other kids. They're not getting all of these exposures to different things like they otherwise would. And I was worried that if they weren't exposed to these things, that their immune systems would not develop properly and would not be as robust as they otherwise should have been. So I remember, gosh, I would take my kids to like a playground, and there you would have parents out there fully masked outside at a playground, their kids masked, swinging on some swings. And here I came with my kids without masks on because I didn't believe that my kids needed them. These parents snatching up their kids, taking them away. And Dr. McCullough, I'll tell you what, we now on the other side of this have seen that maybe that wasn't the best approach for kids, to keep them sheltered and keep them away. Because I think on the other side of things now, have we not seen that it's been pretty bad for kids, not just socially, but also immune wise? There are probably a lot of kids out there who really weren't exposed to the things they otherwise should have been.
It's true that the lockdowns were completely unnecessary for children. And, the Great Barrington Declaration was published in October of 2020 by Dr. Jay Bhattacharya, who's one of my frequent contributor group at Fox, and Sunitra Gupta from Oxford, Martin Kolda from Harvard. And it said this, that we understand the virus now. It's only going to really impact the elderly, the frail, and that everybody else should go about their business. It assumed we were all going to get it, which we did. There's a paper by Clausen and colleagues from Harvard showing that 97% of us, several months ago, have already had it now. It's already through the population. And that what happened with the children is most of them had already had it early on. The CDC knew this. The CDC had the statistics. There were no major school outbreaks, none. There were no major cases where a child gave it to a teacher and a teacher had bad outcomes. In fact, the teachers had good outcomes because they had relatively robust immunity. Mm-hmm. And what happened is the children became developmentally delayed. They missed milestones. They've been behind in their learning. The children who are masks have trouble with phonation because they can't, they're not seeing the facial expressions. So the whole program of locking down society as we look backwards now was a complete disaster. Multiple analyses have been published. Not a single one justifies the lockdown.
Yeah, I mean, it's such a shame what we all went through. You personally, though, I feel like you were really attacked in a lot of ways during this entire process. You kind of became a bit of a controversial figure. Tell me about that and what that was like for you, because I assume as a doctor, look, you're out there trying to help people. You're out there doing everything you can to try and figure this out, to save lives, to help treat people, to do the right thing. How did that happen? Like, what happened with all of that?
Yeah, I can tell you, I'm one of the most published doctors in the history of our country. In my field, heart and kidney interactions, I am the most published. I'm one of the most published people in COVID-19, including the very first treatment approach. I've given more media and commentary on the pandemic than any public figure, more than Fauci, more than Walensky. Do you know that I've never been confronted by anybody of my stature, not a chief of medicine or a dean or a division chief, and whoever disagreed with me? I've never been attacked by another doctor who disagrees with me. So this idea of becoming controversial, it's kind of like in whose eyes. We realized that there was just a lot of censorship on social media. I was kicked off Twitter for about 2 months at the end of last year. And, during that time, someone made a hashtag Dr. McCullough. I was trending #1 in the world, just ahead of the World Cup most days. So they had a vote. They said, should we let Dr. McCullough on? It was 98-2 to let me back on. So, I'm back on Twitter. I have probably the top doctor account of doctors who see patients. People, rely on my judgment. I've been very careful. I've correctly actually predicted all the twists and turns of the pandemic. I always cite the information like I did today in this interview. If you ever notice, most doctors come on, certainly Fauci, Walensky, they couldn't cite any of the papers. I was pinpoint. I won Laura Ingraham and dozens of times, Tucker Carlson. I've been on Newsmax. I've been on ABC. I always cite the information, and I'm disciplined, and that's how I ended up where I am now.
Wow. Well, good for you. That it's so nice to hear that it hasn't impacted you? Because it's hard, obviously, to be kicked off Twitter. Why were you kicked off of Twitter? What was their rationale for that?
Violating the terms of community rules. There was never any justification for it. And I'm back on, and I provide helpful updates. I've branched out in the media like you. I have a top medical podcast called McCullough Report on America Out Loud Talk Radio. I've got a Substack, Courageous Discourse, which I started during my Twitter ban, became very widely read. I published a book, Courage to Face COVID-19, with best-selling author John Leake, about the early years. Peter Navarro had reached out to me from the White House very early on to help him with trying to unlock hydroxychloroquine out of this box that it got put in with the unnecessary emergency use authorization. And then Senator Johnson and others. I was the lead witness in the U.S. Senate on November 19th, 2020, and then organized and co-moderated 2 major sessions later on. We made great progress. The great regret is our pandemic response was not egalitarian. It was simply became a dictatorship by one person. And we needed teams of doctors in Washington. We needed teams of doctors who were treating patients that understood the illness, and we needed frequent updates. We could have been through this, and I've testified now under oath. I think we could have saved 2/3 of 1.2 million lives lost, and we could have avoided 2/3 of 6 million hospitalizations. That's really the toll that was taken.
Wow, what a shame. And I assume that in medicine, more opinions are better. You want to hear what others' protocols are and how you approach different things from different ways, and that's how you kind of come to a conclusion, right, as to what would work better. So I assume you're referencing maybe Dr. Fauci when you say the one person that was kind of in charge of it all.
Right. You never saw him say, well, listen, I'm not sure. Let me get a team in here and we're going to review early treatment protocols, or we're going to review what's the best monoclonal antibody strategy. In the field, it was terrible. We were trying to get hydroxychloroquine or ivermectin or bamlanivimab or sotorivimab, and we were just struggling. It seemed like every drug that we needed to save lives, it was hard to get. We weren't getting any support out there. What we really needed is we needed full-throated support that said, listen, we're going to let the doctors do everything they can to save Americans, and the government get out of it. If the government was not in the business of pandemic response, if they did nothing, it would have been so much better, because we just would have used our medical instincts and saved lives. Instead, the government stepped in and said, nope, can't do this, can't do that. Before we know it, there were government protocols for the hospital. The hospitals weren't deviating from them. They were very nihilistic, and American lives were lost. Yeah.
And the sad thing is, too, obviously having never dealt with something like this in our country's history, I think that, when you look back at my father-in-law, who was the president when COVID happened, he's not a doctor. He's not a medical expert. So he had no choice but to rely on the guidance and advice of those who he was given. And of course, one of those people being Dr. Fauci. And now all of the things, Dr. McCullough, that we see that could have been done, as you just said, differently. And it almost feels like they led him down a path where they lied to him, where they didn't tell him the full truth, where they were, for whatever reason, just only presenting one option for things. I think you're right. I think it is such a shame to look back on that and see how it all happened. I will say, I'll give my father-in-law a lot of credit. No other president could have mobilized the private sector in the way he did, gotten all the ventilators made, in such a historic way. We've never seen something like that happen. So for all that went wrong with that, it is kind of great to know that we did have a president who was willing to do everything possible, and he really did, to try and save lives. I want to ask you about post-COVID, because you're right. I think most people have had it. You would know. You said like 97% of us have had it. I got COVID almost 2 years ago for the first and only time that I know of. And the worst part of it for me was losing my smell and my taste. I lost that for almost a month. And that is such an upsetting situation. It's still, Dr. McCullough, has not fully come back for me. Do you think those of us who have experienced this, will I ever get my full smell and taste back? Is this kind of my new normal now? Is there anything we know about this? What can you tell me?
I think you will. I bet you didn't use the virucidal nasal washes and sprays.
I didn't even know about that till you just told me.
Republican Congresswoman Nancy Mace came out in 2021. She had a big piece in Epoch Times. She said, why is our government not telling us about this simple, inexpensive approach that can cut down on the viral damage and spread up there? It turns out that just dilute povidone iodine or dilute hydrogen peroxide, or there's now commercial products, Cofix RX, Clear, and others. They work great. And they cut down the amount of viral replication, which literally can damage the olfactory nerve. She was so frustrated. By the way, the masks didn't work, but the sprays and gargles did. Sprays and gargles turned the PCR test negative in 3 days. So we could have cut down spread massively if everybody would have been using them. And they were using them widely in Bangladesh and other countries. That's where a lot of the research was done. So it was a giant shortcoming. What we know now is HHS in 2022 has put out basically a spend of about $1 billion for long COVID syndromes. Nothing has come out of it. Nothing. It's been a giant waste of time. What we've done is we've looked at it, a recent paper from Harvard that's very important, shows that people like you probably have circulating spike protein from the virus in your bloodstream. People who have residual symptoms still have a fragment of the virus, the surface spicule that's circulatory in the bloodstream. And this is very important. The first author is Swank and colleagues. And we now know that there are at least 2 natural substances that help digest this spike protein. The spike protein was engineered in the Chinese biosecurity lab in Wuhan, China. It's artificial protein. That's the reason why we can't break it down. So the natural enzymes that break it down, one is nattokinase. The Japanese discovered that. It's a fermentation product of soy by a bacteria called Bacillus subtilis natto. And the other is a family of enzymes that's derived from the stems of pineapples called bromelain. So both nattokinase and bromelain, which are available as oral supplements, you can buy them at nutraceutical stores or online, they break down the spike protein. They're also mild blood thinners. And so the spike protein is promoting blood clotting. These are helping attenuate that. And then there's a final natural substance called curcumin. It's derived from turmeric. It actually seems to buffet some of the effects of the spike protein. I've been working on this for 2.5 years. I have a major publication that's been fully accepted on using this approach now. I've tried all the prescription drugs, and very few work for these generic long COVID syndrome like you have. This kind of taste and smell is probably your only manifestation. And so this, what we call triple base detox, that is the base of our detoxification of the spike protein, is nattokinase, 2,000 units twice a day. That's equivalent of 100 milligrams twice a day. Bromelain, 500 milligrams once a day. And then curcumin, 500 milligrams twice a day. We're having our patients do this for about 3 months. On the short side, you would probably only take about 3 months. Other people more severely affected, 12 months. I can't make any therapeutic claims because we don't have the large randomized trials. We only have randomized trials so far in curcumin. But my clinical observations are telling me that people improve. They get their sense of taste and smell back. They have numbness and tingling. It goes away. We have improvement with problems with blood clots, heart damage, etc. So believe it or not, an unnatural protein, and the clinical response is 3 natural products.
Well, I love that approach. I'm all about the natural route, Dr. McCullough. That's how I like to operate. So what you just said sounds great. If I want to go look up, what you just said, or maybe the audience does, is there somewhere we could go to find this?
Right now, the best-in-class product that has the data online is the Wellness Company has spike support, which is nattokinase plus some minor products. My paper will be appearing shortly in the journal, the Association of American Physicians and Surgeons, and then I'm going to have a parallel paper in preprint and some executive summaries. It'll be a major paper, just like the first McCullough protocol paper was in the American Journal of Medicine. That was the most frequently downloaded and read paper in all of COVID-19 during the early phase. And I think the detoxification paper will also be, will be a major headliner. Americans, first off, wanted to know, well, how do they treat COVID to stay out of the hospital and stay alive? I provided that. Now they want to know how they can get out of these persistent symptoms, and I've tried to deliver there as well. And I've been out there trying to help as many people as possible. And Senator Ron Johnson and Roger Marshall, Rand Paul, and others have. The sad thing is we haven't had our public health agencies. No one's come forward from the CDC and said, here's something practical you can do to get over this, or from the FDA, or from any of the government agencies. They really have not been helpful to Americans.
What do you make of that? Why would that be?
It's just, in many ways, it's just been a giant disappointment. Our public health agencies have really dropped the ball altogether. And we don't know if it was the fact that they dispersed and they were trying to work by Zoom, or they were gripped by fear. But Rochelle Lewinsky, we've actually gone through 2 CDC directors. So we've had Redfield out, now Walensky out. Walensky came out and said, we made large mistakes. We're going to need to overhaul the agency. We've seen, we have 3 FDA commissioners. We have Scott Gottlieb. He went to Pfizer, so he's now, obviously very biased towards vaccines. Then we had Stephen Hahn. He's gone to the venture capital firm for Moderna. So he's kind of tipping his hat there. Now we have Robert Cale, who's one of my associates, but we haven't had any strong leadership. We haven't had any government public health officials come out and say, America, this is what you should do for us to get past this. We have not had that. I've tried to provide it as best I can from the clinical community.
Well, I'm going to vote that when Donald Trump becomes the 47th president, which I believe will happen, I'm voting Dr. Peter McCullough in there. We need you to do something to fix this. I mean, the truth is, people really lost so much trust. You're right, in the FDA, in the CDC throughout COVID. All the information it felt like we were getting wasn't working. People obviously knew the masking was just a bunch of garbage. It was just worthless and pointless. And yet every time you went into a public space, every time you got on an airplane, people were on top of you to get your mask on, make sure you wear it right. Oh, you could pull it down to take a sip of your water, but you better put it back on. None of it made any sense. And I think people were like, this is crazy. How do we trust these agencies? I'm going to throw your name out there, Dr. McCullough, as my choice, because I tell you what, you make a lot of sense. I have like a million questions I could ask you all day. The last thing I want to ask you, what is it? Is there anything right now that you feel people should be aware of? Anything that concerns you that you're looking at? Anything that you feel like you want to just tell people today in August of 2023?
I think we're at the point where we're at the closure of the vaccine era. There have been many calls to just go ahead and retire the vaccines. They haven't been able to keep up with the variants. If someone's following the government protocol on vaccines, they're on their 7th shot. I don't know anybody who's taken 7 shots. There's been no public figure who said they've taken 7 shots. And so I think there's basically been a loss of confidence there. And certainly great concern for those who have had complications. Former President Trump has consistently said he would never mandate them. He never would have. And I think if there were no mandates on the vaccines, we wouldn't have so much consternation over them. But at this point in time, I think people want to move on. They don't want to have any mandates. If any, I think there's about 93 colleges that are still mandating them. They're unwanted. Most of the government agencies have dropped it. Finally, the military has dropped it. But I think we just need to drop all the mandates, just kind of retire this era in medicine. Then we'll need to do an evaluation on how to do better next time.
Oh, I hope there is no next time. But the truth is, as you say, this virus came from the Wuhan Institute of Virology. We still don't really have any clear insight into exactly what happened there for whatever reason. We still don't know. And so I think, a lot of us are afraid, well, we didn't really get to the bottom of this one. Why would we not expect to see something like this happen again in the future? And I can tell you that things would be very different for round 2. I can tell you people would not comply with the nonsensical mandates, with the whether it's masking, whether it's getting vaccinated or whatever it is. People are not going to do it a second time around. It would be just, I feel like pandemonium would break loose. But we really don't have any answers at this point. So it's kind of a shame. Where can people find you? Dr. Peter McCullough, we appreciate it. Where can people find you if they want to follow everything you're doing? Because you got a lot going on.
Thanks. Well, my website is a central area to get to all the buttons, petermcculloughmd.com. My podcast, America Out Loud Talk Radio, McCullough Report, is 2 p.m. Eastern on America Out Loud Talk Radio, Saturday and Sunday. Then it's on the Apple iHeart iPod podcast network. My Substack is Courageous Discourse. It comes out every day on the Substack application. My book, CourageToFaceCovid.com. It's a 5-star bestseller on Amazon. It's the only book, and actually former President Trump is in the book, Peter Navarro, Joe Rogan. I set all the records on Joe Rogan's podcast, and Tucker Carlson. I started him down this pathway, 2-year pathway that you know how it happened on Fox. So I was very involved in all this. It's all in the book, and it has a beginning, a middle, and end. It's kind of a gripping story, CourageToFaceCovid.com. And then finally, I started a foundation, McCullough Foundation, 501c3. I'm involved in about 100 cases as an expert, pro bono. So I need the support to do that for military, people who've been wronged through the pandemic, and that's McCulloughFND.org.
Amazing. I don't know when you're finding the time to sleep. Yeah, it feels like you've got a lot going on there. Dr. Peter McCullough, thank you for joining us here on The Right View. We appreciate it. You're the guy to go to. I hope we don't have to ever do it again, but should we, I feel you're the first call that I would make. So thank you for all of your expertise. Thank you for all of your hard work, and thank you for joining us today on The Right View. We appreciate it very much.